This video is on the skeletal system. But particularly on the axial skeleton. So since we're talking about the axial skeleton, let's first define what that means. So the axial skeleton incorporates the spine, the rib cage, and the skull. Now, we already covered the skull specifically, so we're going to jump into the spine, rib cage, and also the sternum. Now, since the sternum is closely tied to the rib cage, I'm going to add it in here. And you'll see what those bones are in a moment. Now, let's start with the spine, and I'm going to just draw a representation of it out on the side here, and we're going to kind of label everything. So I'm going to draw a little skull here. All right, that's my little tiny skull. We're not paying extra attention to that right now. But now let's go through, and I'm going to draw a little square for each one of our spine bones. And those spine bones are called vertebrae. Now, we're going to start with the ones directly inferior to our skull, and that's actually called our cervical spine. So we're just going to use boxes to represent them. All right, so see how I have a bunch of little numbers there? Those are numbers 1 through 7, and that's because the cervical spine has 7 vertebrae, or 7 of those small spine bones. So I'm going to color them in. As always, I'm using colors to kind of help us, identify colors and identify different aspects of anatomy visually. So this is our cervical spine wrapping up with those 7 bones. So let's actually just label those to the side. Cervical spine. Sometimes this is called abbreviated as C/S. So that's what I'm gonna do when I'm referring to it, is I'll just abbreviate it as that. And I'm just gonna make a note here that there are 7 vertebrae. So next we're going to move to something called our thoracic spine, and I'm going to draw boxes for that as well. And there are 12 vertebrae in the thoracic spine, which is just too many for me to draw. So I'm going to do a little ... with a few more here at the end, just to make it a little bit easier for us. And I'm going to color these in, and then I'll number them in a moment. So that's our thoracic spine, also abbreviated as T/S. There are 12 vertebrae, and they are connected to ribs. And we'll see how the ribs are connected to the vertebrae a little bit more in general as we move forward. Now let me number these out. And I'm just going to say ... going down to our last ones, number 11 and 12. Then our next step in our spine is our lumbar spine. So I'm going to draw a few boxes out there. There are actually only 5 vertebrae in the lumbar spine, so that kind of makes it easy for us because I can draw all of those out. So that is our lumbar spine. abbreviated L/S, that's our low back. Okay, so the cervical spine, even though it's represented really long here, that's your neck. Your thoracic spine is like your mid back and everywhere where your ribs are. And then your lumbar spine is your low back. So there are 5 vertebrae here. Now, sometimes people think that our spine ends there, but it doesn't. We have 2 more parts. One part is going to be our sacrum, which I'm going to draw just like that. And I'll color that in for us. Now, the sacral spine is a little bit different than the other aspects of the spine because it is collectively basically referred to as the sacrum. And it's actually 5 fused vertebrae. So that's why instead of this being known as like the sacral spine, it's actually just known as like the sacrum, which is one big piece. But I'm going to draw some like little lines in here so that you remember that it's actually 5 different vertebrae that are fused. And then the last piece at the very bottom is our coccyx, which is also known as our tailbone. And what's crazy is that our coccyx is actually also either 3 to 5 fused vertebrae, depending on the person. So for the main components, or like the more superior components of our spine, we talk about them as the cervical spine, our neck, the thoracic spine, our mid-back, and then our lumbar spine, our low back. Oops, and I forgot to label our lumbar spine. So it can get kind of confusing because there are a lot of different numbers here. So what I want to do is give you a little bit of a trick to remember the different numbers in each of these 3 upper parts of the spine. So you can think about it as breakfast, lunch, and dinner. Oftentimes people wake up early and eat breakfast at 7 a.m. They'll eat lunch at 12 p.m. and then dinner at 5 p.m. And then it's a little bit easier to remember these last 2 because they're kind of similar to the lumbar spine, except for that the coccyx can consist of either 3 to 5 fused vertebrae. So this is our spine as a whole. Now, there's something else that's pretty important here. What I'm going to do is I'm going to draw our spinal cord. Now, these boxes represent the different vertebrae. They actually represent the main part of those vertebrae, which is actually called the body, which we're going to look at in a moment. But I want to draw in our spinal cord, and it goes all the way up from our head up here, and it goes all the way down to about L1 or L2. Now, why do we care about that? Well, one, we care about it because it's closely related to the spine, and essentially, one of the main purposes of the spine is for it to protect our spinal cord. So I'm just gonna add a little note to the side here that yellow is our spinal cord. And we care about that not only because our spine serves to protect it, but also because it can help us out in terms of treatments that we provide for people. Now, this is important because for medical procedures where there's something called a lumbar puncture, which is essentially also called a spinal tap, and that's where someone will insert a needle in between something called the lamina of the different vertebrae or those spine bones, and they insert a needle into the sac surrounding the spinal cord. And the purpose of that is to get some of the fluid that's around that sac. Now, the reason I'm saying that is because if we insert a needle and we're going to poke someone in their mid-back, well, you know what, the spinal cord is right there, so it's pretty dangerous to do it. So how we determine where to do a spinal tap or a lumbar puncture is we look at your lumbar spine, and since we know that the spinal cord has to end around L1 or L2 is how we refer to them. L is for lumbar, so we say L1 or L2. We always make sure we do those lumbar punctures around L4 because we can be certain that our spinal cord has ended by that level. So if we poke in there, we're not at any risk of damaging it. All right, so one last thing I'm going to mention is we do the same type of naming for the other places in the spine. So like if we're looking at nerves that come around the third fused sacral bone, we'll say S3. And then if we're talking about the fourth vertebrae in the thoracic spine, we'll say T4. Same thing with the cervical spine. If we're looking for the middle of the spine at the fourth vertebrae, we'll say C4. So it's always the first letter and then the number of the vertebrae. Now, so here we have this global look at our spine and all the different vertebrae, but let's take a closer look at the vertebrae themselves, these little things that are represented by the boxes. So let's take a look at vertebrae. Now, what I'm going to do is I'm going to separate this into 3 different sections for those main 3 parts of our spine. So we're going to be talking about our cervical spine, our thoracic spine, and our lumbar spine. So those are abbreviations at the top. And then we're going to draw 2 different views of those vertebrae in our little chart that we've created here. Okay, so up in this top section, we're going to have a superior view. So I'm going to write that sideways here for us. Superior view. And remember, if we have a superior view, that means we're looking from the top down. We're also going to have a lateral view, and that means we're looking from the side at that vertebrae. Okay, so bear with me, it's going to take a little while to draw these structures out, but we're going to get them all drawn first, and then we're going to start labeling the different parts of them, okay? If you'd like to, you feel free to fast forward through this as well until they're all drawn out, and then you can draw them out yourselves, just in case you don't want to sit through me drawing, although sometimes it's helpful to kind of draw along with me. Because if not, it's kind of easy to just get lost. And if we do it together, it's almost like, oh, you know, that wasn't so bad. So what's great is all of these are going to be symmetrical. So we're not, and actually most of, you know, we talked about most of anatomy is symmetrical as well. So remember, this is our superior view of one cervical spine or neck vertebrae. Now, since we're looking from the top down, what I want to do is I'm just going to put a little P here and an A here. That represents the fact that this is anterior and this is posterior. Now we're going to keep going with this superior view and draw out our other components as well. And the reason why I'm drawing one out for each different part of the spine is that they, overall, almost all of them have the exact same parts, but they're shaped a little bit differently. And it's really important for us to know what these shapes are because these shapes dictate the different movements that they allow us to complete in these different parts of our spine. Oops, I forgot a few little circles here on our cervical spine. So I'm going to go back and draw them. Alrighty. If you're drawing along with me, hopefully this kind of makes it look easier because, you know, it looks a little less intimidating if we do every step of the way together. Alright, we're almost done with these superior view segments. Oops, I forgot to put the anterior and posterior label there. Alright, I think we did it. It looks like we're pretty much done here for our superior views. Now let's move into the lateral view and then we'll get to labeling. Since this is a lateral view, that means we're looking from the lateral aspect of it, and we're basically viewing the structure in that way. Now what I'm going to do is I'm going to write an A and a P here to help us note that this is the front and this is the back. And all of these segments will be drawn in the same way. Again, this is posterior, this is anterior, and one last one left. You stuck with it, and it's paying off. Alrighty, sweet, we're done. This is posterior, this is anterior. Alrighty, now let's get to labeling, which is the fun part. So we're going to start with our articular facets. What that means is articular essentially refers to the joint for anything. So an articulation is a joint. So when we talk about articular facets, that means they're facets that form joints. Now, all of these different aspects of our spine, these different vertebrae, are lined up with one on top of another. Now, our articular facets are where one vertebrae articulates or forms a joint with another vertebrae. Okay, so I'm going to color them in here on our cervical spine first. Now remember, we're looking down. So this is our superior view. We're looking down on this vertebrae. So let me color in these articular facets here. They're going to be here on our thoracic spine and here on our lumbar spine. Not too bad, right? They're all in the same places. So let's label articular facet. And then I'm just going to make a note that we have superior and inferior ones. So since this is a superior view for all of these, we're looking down at them and we see the top of it. So these are all superior facets. Okay. Now, for these ones down here, when we're looking at the lateral view, we can see those same superior facets. That superior facet is right here. That superior facet is right here. And the superior facet is actually on the inside of these little parts right there. So the lumbar spine is the only one that looks a little bit different. And then we also have inferior facets. So we have one here. Oops, you know what? I messed up. I forgot to draw on one little part here. But I labeled the wrong thing right here. So I apologize. That shouldn't be a articular facet that I made in pink right there. So scratch that for a moment and we'll color it back in with a different color because this up here is actually supposed to be our superior facet. Here's our inferior facet. And then we also have an inferior facet right here on our lumbar spine. Okay. Now we have a different type of facet, and that is called a costal facet. Whenever a costal facet, same thing, no matter how you pronounce it. Now the thing about that is that our costal facets are only in our thoracic spine because whenever we say the word costal, we're referring to ribs. And remember, our ribs are the only part of the spine that the ribs connect with is our thoracic spine or our mid-back. Therefore, the only ones who are going to have costal facets are our thoracic spine vertebrae. Okay? So let's add that label in. Costal facet. And remember, that is only in our thoracic spine. And then for these, we also have superior and inferior ones, just like the articular facets. Now let's go through and label those. Of course, right here we have our superior view. So we're not going to be able to see the inferior facets, but we're just going to draw them in, the superior ones in. So let's get our superior ones drawn in right here. And then here, the one that I accidentally colored pink, that was incorrect. That's going to be our superior facet right there. And then we're going to be able to see our inferior facet right here. Now we also have transverse costal facets. So we're going to add one more thing in here, transverse. And those ones are, oops, I forgot to draw on a little circle for it. Those ones are on something called our transverse process. So we'll get to that in a moment. That's going to be the next thing we're going to learn. But these brown dots right there and right here, those are our transverse costal facets. Remember, these three are superior costal facets. And this one right here is our inferior costal facet. So it makes sense. It's really based on location. Now, why are those transverse costal facets? Basically where our vertebrae form a joint with our ribs. Why are they called transverse? Well, it's because I said they're on the transverse process. So let's label all our transverse processes on all of these. Our transverse process is these things that stick out to the side. So let's actually do it on everything. So we have transverse process right here. They look a little bit different on the cervical spine, but you know, each one of the vertebrae look a little bit different. So there's these things that are sticking out right here. And then you can also see one from the lateral view just sticking out right there as well. Then we see them here in the thoracic spine. This would actually be coming out into the page if we were actually, you know, looking at this as a 3D image. So make sure you're also referencing those models and the images on the internet. And then, but from the superior view, we can see them sticking out to the side here. And then we can also see them on our lumbar spine right here. And they're these guys sticking out to the side. So let's write down our label for that. I'm going to draw a little line here just to separate our labels. Transverse process. I'll add a little bullet next to them to make sure that we're paying attention to each separate term. All right, so transverse process is the thing that sticks out to the sides. Now let's talk about the main part of our vertebrae that I drew as a little square when we were first talking about the vertebrae. That biggest part is called the body, and that's this thing right here. So you know what, let's write that word down before I forget. Body, or vertebral body is the full name of it. We can also see it from the lateral view right here. Now the easiest way to learn all of these things as we're coloring them in is comparing them to real life pictures. So make sure you're also comparing them to the models as you review this. Oftentimes people will get compression fractures at the vertebral bodies when they have conditions like osteoporosis, which means that people's bones are essentially becoming more porous. And what happens is, you know how I said like all of these different vertebrae are stacked on top of each other? Well, in between each vertebral body is a disc. If you've ever heard of someone saying like, oh, I slipped a disc. Well, you know, slipping a disc isn't actually how it happens. The disc doesn't just slip out. But what can happen is part of this like outer ring of the disc can get damaged, and it can start almost kind of like spilling out. But it doesn't happen where the whole disc just slips out. So anyway, a lot of times people use that term incorrectly. But our bodies are what are really like stacked on top of each other. And in between each of our bodies, our vertebral bodies, there's a disc. We call it an intervertebral disc. And then the other place out there our vertebrae are in contact with each other are our facet joints. Now that's important because, you know, anytime when one bone is contacting another one, it's an area where we could potentially have pain. So if anyone gets into anything like physical therapy or osteopathy, which is essentially just like bones, dealing with bones, that can be an area of focus because that might be an area where your patient might have pain. So anyway, that's our body. Now let's discuss our actually we already did it. Let's talk about our spinous process. going to be this part sticking out posteriorly. As you can see, the bodies change size as we go, and they actually get like bigger, and same with the spinous processes. The thoracic spine vertebrae actually kind of looks like a giraffe from the side, which you can see, like, here are the ears, here's the little giraffe nose or whatever it is, lower part of the head. And then the lumbar vertebrae from the lateral view actually looks like a moose a little bit. So this is like the moose head with like the little antlers up there are the facet, where the facet joints are. Alrighty, now you know how we talked about the costal facets that are only in the thoracic spine? Let's talk about something that's only in the cervical spine now. So that is called, or the name of it is the transverse foramen. Now remember, we talked about foramen with the skull. Foramen just means hole. So there are little holes, and whenever I draw holes, I'm going to try to keep them like a little bit open so we can see that they're kind of clear. So I'm going to put a little bit blue there. It didn't really stay open, so that's my bad. But here, when we can see them there, I'm going to keep little hole open. And those are just going to be holes that are only in our cervical spine. So I'll write that, cervical spine, and then we have those holes because we have our vertebral artery and vein passing through them. Now, whenever I write artery, I'm going to abbreviate it with AA. And then whenever I write vein, I'm going to abbreviate it with VV. So that's vertebral artery and vein passing through only in our cervical spine. Now, that's important because there's something called vertebral basal insufficiency, or VBI, vertebral basilar insufficiency, excuse me, and that is a pathology or a condition in which your vertebral artery is occluded, and that's something really important in terms of treating patients who have any number of symptoms or any damage to the spine, because things can be damaged as they travel through these foramen or as they go through the cervical spine in different areas. So that's why it's just important for us to note clinically that, hey, there's some important things traveling through there. Now let's get into a few of the other smaller pieces here of these vertebrae. Let's talk about pedicles. Pedicles, anything with that prefix PED is often related to feet. So this is almost kind of known as like the little feet of the vertebrae right here. So you can see it on both sides of our cervical spine. Both sides of our thoracic spine, and both sides of our lumbar spine. Right? You're kind of hopefully seeing that all of these share some similarities, but they just look a little bit different depending on the shape or the location where they are in the spine. Now the next ones, or the next part, is the lamina. And the lamina are right here. Finish coloring this in. All right, so those are our lamina. And the last thing we have to label on these is our vertebral foramen. And that is actually where our spinal canal is. Now remember we talked about those when we first talked about different canals in the body, and it's called like the vertebral canal or vertebral cavity is essentially this hole right here. But when we're talking about it in terms of vertebrae, we call it a vertebral foramen. So with multiple vertebrae stacked on top of each other, when we're looking through that, it ends up forming a vertebral canal. But right here on a single vertebrae, it's just a vertebral foramen. So I'm going to make this, like, just kind of outline it in this maroon color to remind us that it's still a hole, but it has a name. And they're a little bit different shaped in every different type of vertebrae, as you can see. And this is important because that's where our spinal cord travels through. And that's, remember, one of those reasons why our vertebrae or our spine are so important. Now, what I want to do is I essentially just want to make sure that we understand that this is the general shape of a cervical spine vertebrae, both from the superior view and lateral view, but they're going to change as they go down. So they're going to be different shapes and almost kind of starting to transition into a little more of this shape. And then as the thoracic spine goes lower and more inferior in the spine, they're almost going to start transitioning to these. So it's not like every single thoracic spine vertebrae looks exactly the same. They'll look a little bit different, and there is a sort of transition. But ways we can identify them are, remember, only our cervical spine has those transverse foramen. Only our thoracic spine has those costal facets. And then remember I said that the lumbar spine kind of looks like a moose. The thoracic spine from the side kind of looks like a giraffe. And you can also look at the angulation of how these spinous processes are oriented. So this spinous process in the cervical spine sticks out a little bit more. And the spinous process in the thoracic spine is a little bit more like vertically oriented. Now, we have two vertebrae in the cervical spine that are a little bit different than these ones drawn here. So I'm just going to like make a note of those. So we're going to actually draw them out below. So I'm going to create a little line here. And we're going to use some of the same colors here, but let's see, on this side, let's do, remember if I'm talking about the first cervical spine vertebrae, I'm going to call it C1. The other name for the first cervical spine vertebrae that forms a joint with the skull is the atlas. And atlas refers to Earth. Now the other one, C2, is also called axis. And what a movement that is very important between these two vertebrae is rotation. So you can kind of remember it like the atlas or the Earth rotates on its axis. So we're going to draw both of those out. The first one for C1, I really just want to show you what's different about these vertebrae compared to the other cervical spine vertebrae. So we're going to do a superior view for C1. Now let's draw this out together. See, it does look a little bit different than this. The main idea is that there really isn't as much of a spinous process and there isn't as much of a body. Or there actually isn't one. So we're actually not going to have a body or a spinous process here. There's a different name for them, but that's not something that I need you to know for this course. But just do know that there isn't a body and there isn't a spinous process here. They have different names. But what we still do have is we do have our transverse processes. So I'm going to use the same color and color that in. And what's on those transverse processes in our cervical spine? It's our transverse foramen. So I'm going to color that in as blue. So if you see a vertebrae that looks like this, your C1 vertebrae is the one and only one that looks like that. Now for our C2, it starts looking a little bit more like this cervical spine one up here, but with one notable difference. So we're actually going to draw a lateral view of this one. Alrighty. So this C2 starts looking a little bit more like this. So let's color that in. We are going to have a spinous process here on C2. And same thing as we saw on C1 and every other cervical spine vertebrae, we are going to have a transverse process and a transverse foramen for our vertebral artery and vertebral vein to travel through. And you'll also be able to see our articular facets. So we have a superior and inferior. Now, what I want to draw your attention to here is one big notable difference. That is this thing sticking up in front. So, oh, I forgot to color in. We also have our body here. So see, it really does start to look a lot like this one, right? A lot more compared to this, how this one looks to this one. But one notable difference, and I'm going to label that for us. It is called the dens or odontoid. It's this peach colored thing sticking up right there. I'll write it down here. Dens or odontoid. Clinically, I hear it more referred to as the dens, but you can remember that because dens, it kind of sounds like dentist, and it really just means tooth-like. So it's this big thing kind of sticking up. Now, this is important because it helps form a joint with C1 that makes it very secure and kind of stabilizes things in place, but allows for a lot of rotation to happen between these two vertebrae to help us turn our head to the side. So there is a purpose of this, and there's a bunch of ligaments that kind of help this line up with this C1 vertebrae. And I know it's confusing because we're looking at it within two different views, but when you look at the models, it'll kind of clear it up. But just note that, you know, all of our vertebrae kind of look at the same throughout these different sections of our spine, but here are two special vertebrae that do look a little bit different than the other ones. Okay. Now what we are going to do is we're going to move to our ribs and sternum. Now for ribs and sternum, I'm going to talk about it essentially as part of something called our thoracic cage. And our thoracic cage consists of our ribs which we have 12 pairs of ribs for 24 total. It's going to consist of our thoracic spine vertebrae, which we already talked about, which, remember, there were 12. And then it's also going to consist of our sternum. Now, as usual, let's start drawing these out. So again, bear with me. Feel free to pause the video if you'd like to. And then come back once everything is all drawn out. So this whole thing is our sternum. Now we're going to draw a couple of different pieces that are going to kind of come off of it. So we're going to draw them out on both sides. This is the most boring part of this. It'll get more interesting from here. We're getting there. We're almost done with our ribs. Aren't you glad that you can fast forward through all of this? Makes it not as bad, right? Oops, that looks a little uneven. Unintentional. Your ribs should be even on both sides. Alrighty, sweet. We got this crazy setup here. Let me make all these guys a little bit longer. here, and then we're going to make sense of all these insane lines. All right. Okay, we're rolling now. Okay. So let's start out with our sternum. I'm going to outline our sternum because it's composed of some different parts. But our sternum, as I mentioned, is that first part that I drew out for us, which is this central area. It's really important because it helps like protect the heart and a little bit of our lungs as well. Sweet, so that is our sternum. Alrighty, so within the sternum, we have a few different parts. We have our manubrium, which is this top part right here. Manubrium. Then we have the body of the sternum. And then lastly, we have this little bottom part, which is called our xiphoid process. It's cool because it starts with an X. Not only is the xiphoid process important anatomically as part of the sternum to protect things, but it actually can be a kind of a way for you to locate different organs that kind of sit behind and around it when you're doing something called palpating or just like feeling around there. Alrighty, so that covers our sternum. Now we have something up at the very top that's attaching to our sternum, and that is our clavicle. Sometimes people call it our collarbone. So that's on both sides. And you know, obviously this isn't cut off, but I just stopped drawing towards the sides because it makes it a little bit easier for us if we don't have to draw the rest of the full rib cage. Alrighty, so we have our clavicle. Now we have something in that attaches to the clavicle. That attaches to the sternum. And that is called our costal cartilage. Let me write that in. Costal cartilage. Remember, whenever we talk about the word costal, we mean ribs. So it really means rib cartilage. And our costal cartilage is how our ribs attach to our sternum, as you can see. So we're going to color all of this in. Now it's important that we note where the costal cartilage is, because when we, the location of the costal cartilage and how it relates to the other ribs is going to change how we define those ribs. And that's going to make more sense in a moment. But first we'll just start by coloring it all in. And then we'll kind of get into the nitty-gritty of things, of our different types of ribs. We actually have 3 different types of ribs. And there's some different features between them. Part of that is its relationship to the costal cartilage, so that's why I want to make sure that we really color all of this in very well, because it's going to help us out as we define where our ribs are and what types of ribs they are. So we got our costal cartilage all set. So for our first category of ribs, it's going to be our first 7 ribs, and they're going to be called true ribs. So actually, you know what? Let's label them. 1, 2, 3, 4, 5, 6, 7. Let's color all these ribs in. All 7 of them on both sides. Sweet. Okay, so we got all 7. Oops, I missed one. There we go. Alrighty. Take a look at these ribs. All of these ribs come through and they connect directly to the sternum. See how you can follow the 7th rib in and it still connects directly to the sternum? So let's label our true ribs. And that's going to be numbers 1 through 7. And they connect directly to the sternum by way of costal cartilage. Alrighty, so now let's go to our next type of rib, which is ribs 8 through 10. So we're going to make them dark green. And remember, these ribs in the back go all the way back and connect to the thoracic spine vertebrae. So I have a couple of the vertebrae drawn here, and there's more going up, but I just drew it for our viewing purposes here. Now, these are our false ribs. And that's numbers 8 through 10. And they connect to costal I'm just saying costal that means costal cartilage of rib above. So as you can see here, rib 7 still connects to costal cartilage that attaches directly to the sternum. Now starting with rib 8, let's label it 8, 9, 10. Starting with rib 8, it goes in and it attaches directly to the costal cartilage of rib 7. Rib 9 goes in and attaches to the costal cartilage of ribs 8 and 7. And the same thing with 10, it goes in and attaches to the costal cartilage of ribs 9, 8, and 7, instead of that costal cartilage attaching directly to the sternum like it does in rib 7. Now we have 2 final ribs to look at, and that's ribs 11 and 12. So let's color them in blue. So the view of this is a little funky, remember? This is like, this segment, this chunk of things is posterior, and this is more anterior. So we're looking through the costal cartilage of ribs 10 and 9, in through the body. There's a bunch of organs, and then this is our back. We have some vertebrae back there, and then we have ribs 11 and 12 popping through. It's going to help if you have the model while you're kind of drawing this and labeling it, just to kind of clarify things for you in terms of the view here. But oh, I didn't even write that this is an anterior view. I should have done that at the beginning. But anyway, alright, so we have ribs 11 and 12. Those are called our floating ribs. Number 11 and 12. And they attach only to the thoracic spine, not to the sternum or the costal cartilage. Okay, so those are our 3 different types of ribs and this view of it. The only other thing I want to talk to you about here is let's look at just like a superior view of a rib really quickly. Superior view of rib. So here's gonna be a little vertebrae. There's the little spinous process. There's the body. It's just real simple. And we're gonna look at a rib. You have a groove that you can kind of see from a superior view, a little bit from an internal view as well if you're looking at like the inside of the ribs. And you have a groove there. Let's label it. We're gonna make it this fun, like tealish color. It's gonna be this groove right there. And that is our costal groove. Remember, everything that uses the word costal means ribs. And within that groove on the bone of the rib bone there, you have a few things traveling there. You have your intercostal, meaning between ribs. You have your nerve, which is abbreviated NN. You have your artery, which is abbreviated AA, and your vein, which is abbreviated VV. So that's the only thing I want you to notice on the little models of the ribs is on the inside, you'll be able to see this costal groove where all of those structures will travel. Now this wraps up our axial skeleton.